Good evening, everyone. This is Hussein Hashim from What's Up Media Network. We are joined today by experts in the field and local officials and appointees so we can talk about a pandemic that has been spreading in the whole world and that put the world on a pause. Today we're going to ask the questions and get the answers. We're going to try to take as many questions as possible so we can answer all of your questions. I promise we're going to do our best to answer your questions. I'm joined by my colleague Mohamed Qasim from TCD, and also we are joined by one Dearborn, our friend Rabi Hamoud. We have Chief Haddad, we have Battalion Chief Owens, and we have Dr. Hassan Dakroub, top of the line guest. They're expert in whatever they're doing. We're going to try to get all of your questions answered today. It was over 138,000 cases worldwide. It was over 5,000 deaths, 70,000 cases recovered. In the US, we have over 1,300 cases, was about 18 to 20 deaths. President Trump declared a state of emergency. Governor Whitmer in Michigan, she declared also a state of emergency, and she closed all K-12 schools. And what to come, we don't know. Today, I'm joined by my colleague Mohamed. I'm going to give it to you so you can do your intro, and we go ahead and we can start with our guest. Go ahead, Mohamed.
I want to thank everybody again for tuning in. We will be answering all different kind of questions regarding the COVID-19 virus, coronavirus. We'll be speaking about misconceptions, ways to prevent it from, to be precautious, and stay away from being exposed and whatnot. We were supposed to be joined with Wayne County Executive Chief of Staff Asad Turfi and Superintendent Dr. Glenn Maleko, but they apologized due to the case that's going on in Wetmore Bowls. So they apologize for not being able to come.
Very good. Thank you, Mohamed. Okay. Welcome, everyone. We're going to give each one of you 30 seconds to introduce yourself, your title, what you guys do, and we get ahead and start. We can start with you, Chief Haddad.
Yeah, good evening. It's a pleasure to be here. My name is Ronald Haddad. I'm the Chief of Police for the City of Dearborn. I've been Chief for 12 years now, and basically anything that involves security and safety in our city, I'm responsible for.
Very good. Go ahead, please.
Good evening, Battalion Chief Glenn Owens with the Dearborn Fire Department. I happen to be the EMS coordinator and the infection control officer as well. So all things medical in the fire department go through my office.
Very good. Dr. Dakroub.
Dr. Hassan Dakroub, infectious disease specialist. I'm with Beaumont Hospital. Also, I'm the medical director of Access Clinic and 15 years experience in infectious disease and HIV.
Very good. Thank you all for taking the time out of your busy schedule to join us. I know it's crazy out there, so for you to make the time to come and answer the questions for the public, it speaks loud about your personality, so thank you. I'm going to start with Dr. Dakroub, if you guys don't mind. I know before we started the show, you were telling me a lot of questions. Your phone didn't stop ringing. Why is all of this panic going on?
You know, we're always afraid for what we don't know. What we know, we're not afraid of.
Okay.
The problem is a lot of questions because people are afraid of what's going on. Is this really what it is? Is this really a very highly contagious virus? Are people dying left and right? Are we on lockdown? Are we going to be on lockdown? All these questions. And a lot of question about testing. Testing is something that is on everybody's mind. Everybody want to be tested left and right. And this is not an ending story at all. And I can assure you of something. Looking at you know, case fatality rate, we're not talking about mortality rate.
Yes.
Case fatality rate, because this is an infectious disease. So in the case fatality rate of this virus is very low.
Okay.
So that is something reassuring. you know, the sick and the elderly should be very cautious. But, you know, as far as regular healthy people, I don't think it's any problem more than, you know, runny nose, little sore throat, headache, something like that, and people are recovering. We have a, you know, good example. We have Tom Hanks, who was infected and doing very well, him and his wife. And he's, I guess he's in his 60s, if I'm not mistaken. So it is really, it's a panic everywhere. I mean, it's a panic. It should not be a panic per se. We should be cautious, but we should not push it to the limit because we are taxing ourselves with no reason.
Since you mentioned testing and screening, what is the test available for people? Anyone who want to test, is it available for them? Because when you tell people, oh, if you're coughing or sneezing or you have a bad, or your body is aching, everyone is like, oh, I have coronavirus. I want to go and get tested.
Yeah.
Is everyone able to test?
Well,
if not, who's qualified to test?
Well, okay, this is an excellent question. Here we go. Per Dr. Fauci, Chief Infectious Disease from the CDC and NIH, I can tell you something. We did not do so well with the testing part, you know, because they were still lagging a lot of testing. It's being rolled. I just heard right now, not even 10 minutes ago, that the FDA is just rolling a rapid test. Okay. So hopefully we're going to have it available immediately.
How long does it take for the test results to come?
Well, right now, this is what's going on. I just got a call from Beaumont today about a potential case, and I told them, yes, you got a test. So what they do is they swab the nose, swab the throat, and they have to take it through a courier. So we have a runner that takes it to Lansing to look at the test. So it's a 24 hours turnover, you know, for us to know what the result is.
Was the rapid one, was it big
Hopefully
quicker?
with the rapid one, we're going to have results immediately. Like, maybe in an hour, you know, but like for me, I give you an example for HIV, we have something called AuraSure. In the office, 5 minutes, I can give you the result if it is positive or negative. I'm hoping something like that will be available.
Okay. I wanted to ask our battalion chief, if there are cases that are considered positive, what steps are you guys taking in order where if there is a case that whether we don't know if it's positive or not, that gets transmitted through the ambulances or, you know, through the facilities, how can we assure that cases like that won't become positive just because the prior case was positive and they came, you know, in contact with the same surfaces and whatnot?
Well, and a lot of our procedures have been recommended through the CDC. What we do with our department is all of our guys and gals will don the appropriate protective gear. If it's a mask, gloves, maybe a shield, goggles, while they treat the patient. When they hand the patient off to the hospital, the first thing they do when they get outside is they open up the doors, let it air out, and we have spray germicidals. We spray down everything in the ambulance. We wipe down everything that's been touched or that may have been infected. The crews will actually go ahead and decontaminate themselves as well. When the ambulance gets back to the fire station, we also have a UV light that will kill all virus, all of it, within about 15 to 20 minutes. So we set that up in the ambulance, let that run, and at that point, we're completely decontaminated.
Very good. Chief Haddad, we spoke about panicking. We've seen empty shelves right now. We just went live from one of the stores here in Dearborn. People are online. We've seen a video on TCD, on other basically media outlets, on Costco, around the block. People are standing in lines trying to buy stuff. What's your message to the community when it comes to that part?
You know, our community needs to remain calm, particularly like parents for their children. I think that we've taken huge mitigation steps. You know, we've closed schools, the places of worship shut down, all main events, meetings, the universities all over, not only in our state, but all over the country have shut down.
Yes.
And that puts us in a great spot not to have a wide access to the disease itself. So I think families should work together and make sure that they keep everyone calm. Certainly with the susceptible group of seniors and babies and those with some health conditions, we should keep a close eye on them. But as a family unit and as a city and as a community, we need to stay calm and just work through this.
Very good. Dr. Dakroub, people are scared, like we said. What's your recommendation for them as precautions, as prevention? And I'm going to ask you a couple follow-up questions if you don't mind.
Sure, no problem. Well, as a precaution, like Chief Haddad said, we have to stay away from crowds. Any crowded places, as much as we can stay away from, we should. We should practice common sense. And, the way to do it is this. If you have your hands getting dirty, wash them. Make sure that you put hand sanitizers on your hand frequently if you can.
Okay.
Washing the face multiple times a day is not a bad idea either. So basically wash your hands, then wash your face and wash your hands again. Avoid crowds, as I said, as much as you can. And things are already being shut down. Schools have been shut down. That's a big burden because in schools things start getting from one kid to another.
Yeah.
So this is a big thing. I see places, other places.
When you talk about schools, is it too late? Is it late now?
No, it's not.
It's not?
It's never too late.
Okay.
And it's never late in a contagion situation.
Should have been closed earlier?
No, not really. I think we're doing good. This is the United States of America. We're not some third world backward country,
Okay.
We have all the, wheels in place, all the motion in place, and we're able to, activate stuff. So we are doing our best here. And then you also, at the same time, saying it's very important not to spread panic.
Okay.
Because panic, taxes the system. And when you're taxing the system, you are not helping yourself.
Yeah.
So we have to be cautious, but at the same time, you don't want to tax your ambulance system, you don't want to tax your police, you don't want to tax any of that because they have their job. If we do this, it's going to get worse for all of us, and we don't want to do that.
A lot of people, they put a mask on their face. I see Musa over there is having a mask on his face.
Yeah.
Do masks help?
Not at all.
No. Take it off.
Not at all. So face masks will not do us any good unless somebody's sick. So I'll tell you a little procedure that I do in my own office. We put a sign outside, if you're sick, please inform us that you're sick. So
Okay.
they come in, we put a surgical mask on them, runny nose, fever.
Before they come into
Before
the
they
building.
come into the door. We put a surgical mask, we put them in
The
an
N95,
isolation room.
right?
Not the N95, a regular surgical mask.
Surgical mask.
I'm going to explain this
Please,
in 1 second.
I'm going to give you your time. Go ahead.
Yeah, okay. So what we do is we put a regular surgical mask. Regular surgical mask is meant to protect me from the case.
Oh.
So we put a surgical mask. In case I want to work with that infected case, I put an N95 to protect myself.
Okay.
N95s are not needed. They're out of stock. They're out of because people are just panicking and buying them left and right. If we do this, we're not going to leave any face masks for the professionals.
Okay.
Our ambulance crew, our police that deal with this, we have to be very careful about protecting them too. This is very important. This is public safety measure number 1. Okay? When I have a problem, who do I call? Either the ambulance or the police if I'm at home, right? I cannot tax the police or the ambulance, so we have to be very careful what do we do and what we don't do. So N95 should only be used
For professionals.
Somebody who's sick, they can put a regular, mask on
The one that's
them.
sick, not the healthy one.
Not the healthy one. The healthy one does not need any face mask. The sick one.
Speaking of these masks, it's recommended that people that are infected, that are sick, put it on. Now, it could take up to 2 weeks before you know you're sick, before you see the signs of it.
The signs and symptoms.
Would it be a good precautionary measure to put a mask on, even if you're healthy, just in case, someone that could be infected that doesn't know coughs, or, if you're within close proximity and elevators, anything like that?
That's an excellent question. It's, risk stratifying. You got to risk stratify everybody. So if you're coming from China, from Wuhan, yes, I'm going to put a face mask on you and I'm going to isolate you. Yes, if you're coming from New York, where there is, they isolated the whole area, the National Guard, yes, I'm going to put a face mask on you. Somebody who's walking the street, no problems, no issue. Why do I need to do that? If I do that, I'm just spreading fear, and it's not a good thing. The problem is spreading the fear. Spreading the fear will collapse the system. We do not want to do that.
Very good, very good. So we've talked about face mask. A lot of people are saying you should take your flu shot right now. If you didn't take your flu shot, does it make a difference or not?
Well, some people are proponents of using the flu shot right now.
Okay.
Like I got a question from a doctor yesterday. He said, a doctor in Florida told my patient to get a flu shot right now. So the flu shot, what is it going to protect from?
Okay.
The flu, right? And the flu shot this year is not as efficient or as efficacious as last year because of losing some strains.
Okay.
So getting the flu shot's always an excellent idea, but we're not going to use it right now to protect us against corona. You're not going to do anything.
Very good, very good. Akiri, for sure, I'm going to thank everyone that's watching us on Facebook, on TCD, on WhatsApp Media Network. We're going to take your question. Anyone that have a question, feel free to write it in the comment area. I'm going to speak in Arabic for a bit for our Arabic speaking population and viewers. This is حسين هاشم. أكيد نحن عم نتحدث بالإنجليزي شوي أكثر لأنه ضيوفنا أكثر شيء بيحكوا إنجليزي، بس كمان حي لو واحد عنده سؤال باللغة العربية فيكم تسألوا سؤالكم. دكتور دكروب بيتحدث بالعربي، محمد بيحكي عربي وأنا بحكي عربي، وحتى التشيف والتشيف كمان إذا حكوا شيء بالإنجليزي نحن بنقدر نترجم لكم إياه. فتفضلوا اكتبوا سؤالاتكم، وحيلا سؤال عندكم اياه نحن هيدا الهوا مفتوح عشان عشان نجاوب عن حيلا سؤال انتم عندكم اياه. ف اني كويشن حيلا سؤال بالعربي فيكم تكتبوه بالعربي او بالانجليزي، ونحن بنقدر نساله لضيوفنا الموجودين معنا اليوم اللي هن مختصين في هذا المجال. دكتور دكروب بتكلم عن البريكوشنز شوي، عن الشغلات لازم تنتبهوا لها لحتى ما تنصابوا بهذا الموضوع، مثل انه تغسلوا ايديكم على طول، تستعملوا هاند سانيتايزر، ما تروحوا على تجمعات وهيك شغلات. وحكى كمان انه الفيس ماسك يعني اللي بينحط على التم ما مش العازل او ماسك بتسموه
فيس ماسك شو اسمه، مش الواقي اسمه الكمامه.
كمامه هلا انا عم ترجم عربي طلعت شرفت.
We had the same issue last episode.
فاكيد الكمامه عم بيقول بس للي هو ساخن يستعمل الكمامه، مش للي مش ساخنين. والبروفيشنالز اللي هن بيشتغلوا كدكاتره وكنيرسز وهودي بيستعملوا بروفيشنال ماسك، يعني ماسك اللي اسمه هو N95 هو لهم هن يستعملوه، مش كمان للببليك يعني للعالم مثل العاديين يستعملوه. عندنا شويه go ahead if you want to say something.
Yeah, can I just follow up? We've talked about the mask, so we can put a bow on it. I
Please.
can tell you that our entire public safety team, both police and fire, have that equipment. We're trained, we're test fitted with them, and we're prepared to go, but we do not have an infinite supply. So
That's right.
We're going to use them appropriately, but I want our citizens to know that we've protected our men and women so they can better serve them. So we're good with the masks and protective equipment.
Now, I want to ask you, it's hard for us because we're, very close communities, and some of our cultural greetings are, shaking hands, hugging, cheek kissing, so it doesn't make it any easier, But Governor Whitmer issued a state of emergency and an executive order prohibiting, events and congregations of over 250 people from, being together, congregating. What kind of steps or what is the Dearborn Police Department doing to enforce that and making sure that people,
We haven't had to enforce it. It's early, but I credit and applaud the entire community. Shows are being canceled. Basketball, hockey, the big boys have canceled theirs. The schools are closed. But the state of emergency allows us to get out of contracts if we have to, and it allows public safety to take some extraordinary measures sooner than later if necessary. And that's a real big deal.
There's a lot of parties in town that goes around. Like, we have nightclubs, we have weddings, we have different functions, we have funerals. I mean, I know in Lebanon they stopped. Nobody is allowed to do weddings, even funerals. They told people, I mean, you can bury the deceased, but you cannot do an occasion at the mosque or anything. Let's say someone, has, for example, a party going on or wedding going on, or there's a gathering going on, more than the number that was listed, 250, I think. Yes. Would the police, intervene to stop it?
We would advise and recommend that they don't. Again, it's early, but most people have shut down their businesses.
Okay.
I know that we have a lot of hookahs in our city, and it's where our community goes to relax and talk.
Yeah.
If we can close down places of worship and schools so not to further put us in a bad way, in a threatening environment, I would hope that the businesses would follow suit and just shut down until we get a good handle on what we're dealing with. And I know that we're working very hard globally to find a vaccine for this. And
That's right.
It could be anywhere. I'm not going to talk for the doctor, but I've done a lot of reading on it. But it can take anywhere from 8 months to a year and a half.
For the vaccine.
So the longer we can flatten out that curve on people getting infected, the better. So I would just recommend to our business community to do what's right and not put people in tight borders.
Since you mentioned hookahs and stuff, those who smoke hookah in public places, let's say they're changing the hose, but the thing itself, hookah, it's still there. Would changing the hose help, or it's still if somebody was infected and if somebody had coronavirus and they smoke from the same hookah, they're going to get it?
Look, I want to tell you something. with the hookah, you're doing this, right?
Exactly.
So this is air that's being circulated inside the hose and maybe goes all the way to the actual equipment, right?
Okay.
And I don't do it, but I can tell you, I can see from people that do it, it goes all over the place. So I would not recommend not sterilizing or, at least disinfecting these equipments. And the chief mentioned something very important. It's called flattening the curve. This is something they've just been talking about very seriously now. So you want to, prevent the spread of infection. So this way, in case hospitalization is needed, they have enough beds and enough hospitals to cover the sick people. So
Okay.
our job is to try and prevent people from getting sick as much as possible. And those who get sick, then they can find beds and stuff like that. Remember, that in the whole of the United States, there's 100,000 ICU beds. That's it. So 100,000 100,000 ICU beds that are needed for the sick people when they're sick. So having said that, we have to do our diligence not to get infected.
Yasser is asking you on Facebook, Dr. Hassan, how long it's expected to find a cure for coronavirus, or is there a cure out there yet?
There's a lot of studies are being, conducted. University of Nebraska has started a double-blind, placebo-controlled study about, the use of certain medication IV for, the coronavirus. It's in infancy. How long does it take? Remember, we have the FDA.
Yes.
The FDA takes their time in making sure public safety with all the medication. So it may take a little time more than we expect. They're trying to put, the wheels in motion, but these wheels take time. This is a new virus that is just attacked, so we don't have a clue 100% how to treat it.
One thing I've read is that warm weather affects the virus, decreasing it from spreading. Is that true, or is that a misconception?
What does that say that again? I'm sorry.
Warmer weather.
Warmer weather.
Yeah.
Again, the jury is still out on this thing. As far as warmer weather, yes, it will kill some viruses, because the warmth itself and the UV light and rays will kill these germs. But in the case of corona, it has not been tested yet. So I would be still cautious, even with the ongoing, talk about, the warm weather.
Very good. I'm going to go into treatment a bit, since you opened the idea of treatment, Mohammed, and the thing. And we had the question, you said there is no clear treatment right now.
Right.
So which treatment are they using right now?
Well,
so let's say we have a case right now, which is there are so many cases. What's the procedure of treatment right now?
Well, there's a bunch of medication that are being tried. One of them I mentioned last time, Kaletra, which is an HIV medication I've been using for 15, 18 years, something like that.
Wow.
So that works on coronavirus in combination with Tamiflu, which is the flu vaccine, and the flu virus treatment. So doing combos might work. Some people say use chloroquine. I'm not sure about it. There is an IV drug available in the US on compassionate basis. People are using it with success. And I've seen also people using Kaletra combo with Tamiflu with success. So a lot of these cases are being cured on their own, no treatment needed. And some of these cases requiring treatment are, getting it. Remember, case fatality rate is low with the coronavirus, 0.7%. Some other places, they might tell you, oh, no, it's not. It's 7%, 8%. But you have to look at the factors. Why is it 7% or 8%? Like, for example, when it started in Wuhan, it was 7% to 8% because people were overwhelmed. They did not know what they were dealing with.
Yeah.
Hospitals were flooded. There were no good response. But now we have good response. We have quick response. So the case fatality rate is much less.
Okay, so as we said, there is no cure for it. Off the Johns Hopkins University website, it shows that there are over 137,000 cases that have been confirmed. Total recovered, people don't usually speak about how many people have recovered from it. Right now it's at 69,000. How are these people recovering? Is it just by self-quarantining?
Self-quarantining.
There's no cure. So how are these people recovering?
Spontaneous recovery, immune system's taken over. A lot of these cases, as I said, are very mild. More than 90% to 99% by themselves are, cured. And remember, somebody who had the coronavirus need to be tested twice with a 24-hour difference before they're be taken out of isolation. Let's say you have a case, they have corona, they're in isolation, they're doing well, you have no problem, no fever, no cough, no nothing. They're still in isolation until you do 2 tests, but separated by 24 hours, then you declare them they have no virus, and then they can go out of isolation.
We know the state declared emergency. The president today declared emergency. Did the city in Dearborn declare any emergency, for your knowledge, Chief?
No, just the state.
That's the state. Okay. Did you guys take any extra precautions for your officers when making stops or, at the police station, if so, what are those precautions?
Well,
that
we
has
have
been
taken
And the same
precaution-
question will go to you.
We have
too.
taken precautions to keep our men and women safe, but I want to emphasize the fact that we're going to continue to serve our community and the public as we've always done. Because of the schools and the places of worship being closed, we're going to redeploy some of our directed patrols to better utilize them in the community while people are off and in the neighborhoods. But yeah, we've taken a lot of precaution, and our officers are well equipped. We've ramped up the cleanliness of the police station when it comes to sanitizing, and we're going to keep doing what we have to do to keep our men and women safe and to serve our community.
Does the unified dispatch center that was done, is it both for police and EMS or just police? The unified dispatch center that we have in Dearborn?
No, police.
It's just police?
No, police, fire, and
Police,
EMS.
fire. So let's say you guys get calls from other cities, so Dearborn will be responding for those, or is the department for each one there, for each city? Let's say in Westland, I don't know who's on it, is Westland, the Garden City, if I'm not mistaken, Melvindale.
Yes.
So each fire department and police department will respond, or is it going to be from Dearborn itself?
From their own city.
From their
city.
own city. So we
Except for Melvindale.
except for Melvindale.
Melvindale and Dearborn, we merged about 6 years ago.
Okay.
So Dearborn Fire Department takes care of the entire city of Melvindale as well.
Very good. What's the extra precautions you guys took as EMS?
The first thing that we did is, as far as precautions go, is I contacted the dispatch center because they're our first line.
Okay.
They're the ones getting the information. So they started asking additional questions. When somebody would call 911, they would start asking them the screening questions put out by the CDC, such as do you have a cough, fever, any shortness of breath? Then they would ask if there's any international travel, those types of questions, so they could alert the responding crews on the way to the scene.
Okay.
So if any of those answers were yes, then they could let the crew know, say, hey, be advised that it's a possible COVID-19.
Okay.
So our crews, before they even enter the house, they could go ahead and don the proper protective gear. And that helps out with the police department too, because a lot of the times the police officers will respond with us. And that way we can make sure that they're protected as well as our members.
So let's say, there's a possible COVID-19 case. You guys going to take the person with that possibility, but however, how about the household itself? I mean, if he lives or she lives with someone.
And I'll refer the second half of that to the doctor here.
Yes.
If the individual needs to go to the emergency room, if they need the medical care for it, like we mentioned before, a lot of times you don't need the medical care.
Okay.
Then if they do need it, by all means, we're going to take them to the hospital.
Okay.
And if they are that sick, then we're going to go ahead, load them up into the ambulance. We're going to take care of them, do all of the same work that we normally do,
Okay.
and hand them off to the hospital. The other members in the house, and that's where I'll refer to the doctor on his.
Please go ahead.
No problem. So the other members of the house, it all depends on the index case. If the case in the house end up being COVID-19, definitely, we've told them at the beginning, you have to make sure you isolate them yourself, stay where you are, stay put, don't move until we know a little bit more. If the case end up being COVID-19, they got to be tested. A case that's not COVID-19, then that's fine, no problem, they get to be taken out of isolation. But immediately, if you suspect the case, everybody around you in the house need to be in isolation too.
So everybody needs to be in isolation. How about the household itself? It has to be like sanitized, clean,
Absolutely.
disinfected?
Absolutely, it has to be
Who
clean,
would do that?
sanitized.
Which department?
This is very tough. I think it's at this point in time, the individuals who are living in the household need to be taking care of their own sanitization. That's the only way around it. I mean, they have to be wiping up all, like we do every day in our house. We clean the tables, we clean the floors, we do this, we do that. Whatever is necessary to be done, Clorox, everything, then it has to be done.
So the normal like Lysol, Clorox wipes will kill the virus?
Absolutely.
Okay.
Absolutely.
That's good for people to know, I mean.
Yeah, a Lysol a spray, Lysol wipes, Clorox, all this would work. And I can give you a little advice
Please,
about
go ahead, Dr.
what to do. If you get a liter of water, put 1 cc, 1 ml of the bleach, the Clorox you use for your own household, shake it well, and there you go. You have a disinfectant that you can spray all over the place that will kill the viruses.
Well,
I wanted to add on to an answer to your question
Sure.
regarding what kind of precautions or safety measures the city is taking place. I know I seen on the website several buildings are closing, such as the Historical Museum, the Ice Skating Center, the DISC, the Civic Center, the Ford Performing Arts building. And even City Hall is making it easier where if you have bills, you have to pay. They have a drop box. You can do it by phone, automatic transfers, and whatnot. Now, I want to ask you, Doctor, there is a statistic that is saying that kids are not getting sick. In China, for example, out of everybody's sickness, there was a 2.1% of the cases were children under 19 or young individuals under 19 years old. Is that true? Where
It's very true.
Very true.
It is very true. Kids are more resilient when it comes to COVID-19 that we've seen all over, not just United States, all over the world. You know, China, Italy, whatever, it's striking. You know, good immune system at the beginning, you know, and then at the same time, you have the ones who have no medical illnesses.
Yeah.
So not just good immune system. And speaking of which, I'm going to give you a couple of heads up that I just got today from the DMC, you know, management there about the immune system and how to revamp your immune system. So basically, what we need to do, fasting helps a lot.
Oh, well,
At this point in time.
the fasting will dry your mouth, and says, they're saying don't let your mouth dry because the virus is going to go to your
Right, that's what I was about to continue for you.
Okay.
So fasting from food. Gotta keep
Not
yourself
water.
hydrated. Exactly right. Gotta keep yourself fully hydrated. Fasting from food, help your immune system rebuild itself quickly. Staying away from glucose, because glucose, as we know, taxes the body big time. So staying away from glucose. Vitamin D and zinc, extremely important, along with vitamin C. So if you are able to get your hand on some vitamin D, start vitamin D, zinc, 50 microgram a day would be helpful big time. You know, vitamin C, and then stay away from glucose, and little fasting doesn't hurt no one.
محمود is asking بالعربي. محمود عم يسأل سؤاله لمحمود: عوارض المرض بتكون مع بعض ولا متقطعة؟ محمود in Arabic he asked the symptoms of the coronavirus, does it come all together or it basically come in parts?
Come in parts.
Parts.
So I saw today a video of one of the doctors that work in Spain got infected with the COVID-19. He got it in the hospital. He used to work at University Hospital in Madrid.
Yes.
And what happened is that started with a little fever, then a little bit headache, sore throat, abdominal pain, little diarrhea, and then it started going to his lungs. So he's doing ultrasounds on his lung every day. You know, he's a doctor, works in the hospital, has an ultrasound.
Yeah.
So he was doing ultrasound on his lungs and giving us the progression of the disease in his lung. He's doing fine, but it tells you that bit by bit, it invaded the lung and caused pneumonia, and he's doing fine after that.
Wow.
So yeah.
Maisa Saleh is asking, and I think this is for all of our guests, should we worry about shortage in any supplies or a lockdown situation, as everywhere you go people are buying everything and line are crazy? I mean, we've seen the past 3 days there is no bread in the market.
There's nothing.
I just spoke to the owner of Everfresh. He told me that they told me they sold 4,000 pita bread yesterday. That's crazy. I mean, back to Maisa's question, are we expecting any shortage in supplies, to your best of your knowledge?
I hope not.
You hope not.
This is what I'm trying to, you know, just
Medical
give the
supplies.
message. The medical supplies.
I know we get a lot of supplies from China. Are we worried that we're going to have a shortage of medical supplies?
You know, again, we have a big industry here in the U.S. I don't think we're going to have a problem, you know, rolling these things. You know, just give the U.S. a minute, and they'll be able to rebound and do, you know, and then make all the supplies necessary. However, having said that, we are spreading panic, you know, and then everybody is like starting to buy stuff left and right. They are taxing the system. We cannot do that. We are basically causing our own problem at this point in time. We should not do that.
You should not do that.
We should not do that. We should take it easy.
Do you guys want to respond for that question?
I would suggest the same thing. You know, if you want to save a couple of trips during the week by buying a little more, but to stock up for weeks and weeks, you know, it's just not prudent, and you're really shorting maybe a senior that comes to get,
exactly right.
So, you know, you're going to put the vulnerable at greater risk because they can't fight like the young people for
100%.
for stuff. So, and then knowing our system here, the industry will catch up with it sooner than later. Supply and demand, they'll have more bread on hand and the commodities. But I would just say be reasonable about it, and it's a good practice not to go to the store every day. So if you buy groceries or commodities for a week, I think that's prudent, but don't stock up for months and months, you know.
Would you like to comment on it?
Sure. The only thing I'll say about it, I find it a little bit ironic that we're being told stay away from large crowds, avoid being around a lot of people. And what's going on at Costco and Sam's?
Yeah.
You've got hundreds of people
That's right.
touching everything,
That's
sneezing
right.
on everything, grabbing everything they can, and now you're going out there with them. So by doing what you're thinking of, getting all these supplies, you're actually potentially putting yourself at risk.
Doctor, going back to the incubation period and self-quarantining, there's a delay from the time you're exposed to when you see the symptoms, and it could be contagious without even seeing symptoms. Now they say take up to 2 weeks. Let's say you quarantine yourself for 2 weeks. How do you know you're okay to go out, or how do you know that it's not there?
So if you're quarantining yourself for an actual case of COVID-19, or you're quarantining yourself because you just came from a high contagion area? Let's say you're coming from a high contagion area and you don't have any symptoms for the next 2 weeks, no fever, no sore throat, no nothing, then you're fine.
Okay.
There shouldn't be any problem.
Now, I have 2 brothers right now that are in California.
Yep.
They're going to be coming back in 2 days. Now the CDC confirmed that, or reported that there are 224 cases. From my end, as a family member, how do I go about this? They are young; they're less than 25.
Time not to talk to them anymore.
Stay in California.
That's exactly right. So basically, they're in California. Are they in the area where there is high cases, cluster of cases, or no? That's the question. That's number one question you ask yourself. Second, if you're like somewhere where there's no cases, you're less risk when in an area where there's a bunch of cases. If you come from an area where there's nothing, you want to practice self-isolation, that's fine. It's again isolation for 2 weeks. And then you have to be very careful about, you don't have to kiss them, you don't have to hug them, you don't need that for now. In 2 weeks, you can kiss them and hug them as much as you want. But for now, just hand sanitizers.
Sometimes maybe the area that they were in has no reportings, but these planes and these flights are not necessarily the most sanitized or the cleanest, especially the air filters and the ventilation inside.
Correct.
So people could be getting it just off being on the flight.
100%. Since Mohammed mentioned the quarantine requirement, people are asking why it's 14 days, doctor.
Because incubation period.
Okay.
So the incubation period has been theorized to be 2 days prior and 14 days after. So what you do is you have to stay, put for 14 days to know if this virus is going to show. What does incubation period mean? That means the period where the virus is starting to attack the body and take over and whatever, do all kind of damage and harm. So up to 14 days.
So when you tell them quarantine, doctor, what does it mean to quarantine?
no.
Please explain to them what is
Now
quarantine.
that is
Does
the
it mean you
most
can leave your room,
important
leave
thing.
the house? Does it
No.
mean you can go to weddings? Does it mean you can dance
No.
outside?
You can't dance, you can't go hunting, you can't do any of that. You have
Okay.
to be in your room, isolated from everybody, and at the same time, no going out from that door of your room. You gotta stay inside.
Okay.
The food should come to you. You not go out and get the food. Your own bathroom, nobody uses the bathroom but you.
How about the waste?
The waste stays in the room.
For 14 days?
For 14 days. The waste product, everything has to be plastic. So you send in the food in plastic containers or whatever you can. You want to, practice strict isolation? That's what it is. You cannot take a risk by, oh yeah, you ate, give me back your food, let me go wash it for you. It's not going to work that way.
How about the equipment that they use? The forks, the plates, the stuff?
Everything should be in plastic, garbage bags, put them in the garbage bag, tie the garbage bag very well and leave it for professional disposal.
Okay. After the 14-day quarantine, depending on the result, I'm going to go with 2 case scenarios. First, there is no COVID-19. What should they do? Nothing?
Celebrate.
Celebrate. Damn.
Dance in the
Dance in the
street.
street.
Can they get it again? Let's see.
Yeah, there's a question.
Can they get it again?
If they're not exposed to it, yes, they can get it if they're not exposed to it. But if they got exposed to it and they're immune, no, they're not going to get it again.
Okay.
If you have a case of coronavirus, COVID-19, that is confirmed and you have antibodies against it, you're not going to get it again.
Okay, let's take some questions from Facebook. Do you mind, Mohammed?
Sure, yeah.
Yeah, we're going to take some questions from Facebook. There's some questions in Arabic, some questions in English, so we go back and forth between English and Arabic. So I'm going to في سؤالات بالعربي في سؤالات بالإنجليزي. So راح بنروح نحكي عربي ونحكي إنجليزي شوي. بالنسبه لهول السؤالات لحتى نقدر نجاوب على كل السؤالات. اكيد نطلب منكم انه تسالوا سؤالاتكم لحتى المختصين يجاوبوا عن السؤالات تبعكم باي مجال هن بيتعاطوا فيه. اكيد في كثير سؤالات موجوده على الفيسبوك، على واتساب ميديا نتورك، وعلى تي سي دي، فاكيد نتمنى منكم تكتبوا سؤالاتكم لحتى نستفيد من هذا الوقت ونجاوب على سؤالاتكم. دكتور خلينا نبلش وحده. مصطفى عياد بيسألك هل من الممكن أن تصاب به مرة أخرى بعد الإصابة؟ So can basically, let's say you were infected and then can you get it again one more time?
If you're infected and it's confirmed that you're infected and you tested positive and you got cured, you're not going to get it again.
So these 69,000 that have been reported as
Cured.
cured, they won't get it again.
They won't get it again.
حلو.
But they might spread it unless, because remember there's shedding of the viruses. And the way to know that there's no shedding of the virus is with 2 tests separated by 24 hours. So you're cured, you don't have the disease, but you're shedding actively the viruses. So guys, something got to be careful about.
Asil is asking you, does the vinegar works?
Vinegar works, absolutely. You put it in water.
By itself, or you need more stuff?
Right. So usually they put vinegar with water. Okay. It's good, but it's not as effective as the other methods that are available, like Clorox, which is sodium hypochlorite.
Rabi Hamoud is asking, with the Whitmer Bowles case in Dearborn, health officials are saying that the patient tested positive but not contagious. Is that possible?
That I'm not sure, because I saw the case and I saw the results and everything else. How can you test positive and you're not contagious? If you tested positive for a different, there's many coronaviruses.
They're saying I think she's a female, right?
Was it COVID-19?
She tested positive for COVID-19. That was the press release.
Yeah.
That's in the press release.
That's a press release, yeah.
So confirmed by the state it's COVID-19
Yes.
and it's not contagious?
This is what they said.
So yeah, they said the staff member at Whitmore Bowles who was exposed to COVID-19 was tested as presumed positive for the virus. However, Wayne County Health Department experts do not feel the person was contagious while at the building. How can they not be?
I need more information.
Are there different cases of coronavirus where it could be contagious and not contagious?
I need more information about this, because the way it is, it was put, the expert says this and that, I'm not sure. Maybe they know something I don't know. I don't want to give false information if something that I don't know. More information is needed, and I can tell you exactly if she was infectious or
From
not.
what's the information that's out there right now? If someone is infected.
Somebody is infected, they're going to be shedding viruses, period. I am telling you straightforward, they're going to be shedding the viruses, period. Even people who got infected and cured and doing well, they're shedding the viruses.
طيب, let me take more. I mean, the message is very clear. If you've been infected with COVID-19, you are contagious.
Absolutely.
This is based on the information that's available out there. I don't
Absolutely.
know how, so, I mean, it needs to be addressed the right way.
Yeah, that's right. We need more information
100%.
to know exactly what's
Dr. Khalil Mehdi is saying the stores in Dearborn are out of control. There is too many people at one time in each store. Isn't that a problem?
It's like the chief said, it is definitely a problem. You're putting yourself at risk by being around people who are touching 10,000 stuff at the same time that you're touching. So I don't think it's a good idea. You want some stuff, yeah, fine, go get them. But at the same time, overcrowding, overtaxing the system is never, ever a good idea in any situation.
عبير عم تسأل دكتور فيها الأولاد تلعب برا بالبارك أو ممنوع؟ Can the kids play outside or no? Can they go to the park or no?
Again, if
the kids are off school right now, so
right, that's right.
I need you the 3 recommendations from you guys, because kids are they're off school right now. So what do you recommend to parents? We'll start with you, Doctor, and then we'll go with the chief.
In my opinion, if there is crowds around these kids and playing outside, I don't think it's a good idea right now.
Okay.
If there is nobody and then we know the place, because remember these places where they're playing, they're not being disinfected, right? So we don't know much about the place where they're playing. So it'd be prudent not to do that. I guess they should invest in a PlayStation these days.
And also because of their age, they might not see it.
Right.
But
they'll pass it on to their to family members and parents and whatnot.
Especially very young kids.
I was reading a research paper how when they had the Spanish flu outbreak, one thing that they noticed was that sunlight and fresh air helped the immune system and helped the recovery.
Absolutely.
So
Absolutely.
It's good to get fresh air.
Good to get fresh air, good to get sun, but at the same time, you don't want to get sun or fresh air in a place where it's contagious. Contagious. You don't want to do that because you're shooting yourself in the foot. You don't do that.
Okay.
Go ahead.
Question that,
I want to have you on mic so people can hear your voice.
Oh, if you want to repeat this question,
please, if you don't mind.
Leave it on Facebook. They're asking, is there what is the expected mortality rate in Dearborn, like amongst Dearborn? Because right now, that's what everyone is on nerves. They're most feared about death.
Of course.
So Musa is asking what's the expected mortality rate in Dearborn, right? Just so I can repeat your question on the mic.
Yes,
In
everyone's
Dearborn?
scared about the reason why they're hoarding up and stocking and going nuts is because they think, people are gonna die.
We're gonna die.
What is your honest opinion?
Of course. Let me tell you.
Go ahead, Doctor.
So this is not Wuhan, number one. We're not in Wuhan here. So we don't have tens and thousands of cases that's flooding our system, the hospitals, the whatever resources we have. So having said that, we are prepared. That means that the hospitals are ready to work with whoever cases we got. We only have few cases, a couple of cases.
Sure.
I'm not sure if they're hospitalized or not. Maybe 1 or 2 are hospitalized. So this is not a big deal. Looking at worldwide, it's 0.7%.
Okay.
So 0.7%. So if you take 100 people, 1 person is the mortality rate, 1 person among 100,
Okay.
even less than that. So it's not going to be different for Dearborn. Hopefully, there's not going to be any fatalities from that. Everybody's going to be okay and cured and what have you. But this is what the worldwide. Looking at other skewed numbers, you got like the Wuhan numbers or Iran numbers. These places were not ready for the influx of cases. That's why the fatality rate went up. Now we're steady at 0.7%. Even China reporting less than that. They only had 7 cases today. 7 cases reported in all of China. So that's something to take into consideration. I think the fatality rate is not going to be big.
Chief, based on that, the same questions that we get asked, the last 2-3 questions.
Oh, I believe the doctor.
In terms of playing outside,
Okay.
she did a follow-up question. She said, playing in the backyard, not just the parks, So,
And that's, kids are kids.
okay.
And especially spring and summer, if you lock the kids up inside the house, it's going to get ugly quick. Those kids are going to get very antsy. Like the doctor had said, I think it's great for the kids to be able to be outside, be able to play outside. It's healthy for them. Stay in your own yard, okay?
Right.
If you have brothers and sisters
Yes.
or close friends
Right.
that you've already been in contact with, then yeah, that's great. I would say stay away from community parks because like you said, they're not going to be sterilizing them.
Yes.
And you have the possibility of running into, other kids that you haven't been around. Stick with your close friends that you've been around, your family members especially. And yeah, if it's nice out like today, get outside, have some fun, but be careful. Don't go running down the street to somebody else's house. Stay in your own yard for a little while.
Chief?
Yeah, don't, climb on the toys at the park. Don't touch common bars and places that all kinds of people touch. And that goes, that holds true for doorknobs, We're sanitizing all the doorknobs in senior citizen buildings and other places, So you're better off keeping by yourself with a small group.
Very good. Mohammed, you want to take more questions or you have questions from
Quick question. So one thing is, does it spread through skin contact, number one? Number two, a lot advise that wash your hands and don't touch your face. Is it the skin contact or is it touching your face that would transmit the virus?
So the virus is in the environment, and they saying that it stays on inanimate object like the chair, the table, everything for 14 days. This is what they're theorizing. So let's say it's right here. I touch it. I touch my face. The mucous membrane in my eye or my mouth is exposed, and then so the virus goes to the mucous membrane, migrate inside the mucous membrane to the blood. From the blood, it goes all over the place to the organs. So that's the methodology. If it is just on your skin per se, it's not going to penetrate the skin. But the skin is the method of transmitting it. So basically, I have it on my hand. I shake Hussein's hand. She's going to get
She's
infected.
right now, so probably.
Yeah, exactly right. So I don't know.
Another question. Unless tested, people won't know whether it's a flu or it's COVID-19.
Right.
And common symptoms are, fatigue, fever, cough,
correct.
and body aches. The three of you would be your departments would be involved in the process. You being in the hospital, for example, you
Getting the call and then transmitting.
Yeah, and transmitting. What is the standard operating procedure? Someone calls 911 a week into having these symptoms. It starts with 911, then it goes to the fire department, and then to the hospital. What is the process? I'm calling 911 saying that I have these symptoms and it's been a week.
Well, we're going to do everything that we've always done.
Okay.
Our main goal is to take care of the patients, take care of the residents and the visitors of the city. We are trained, we're prepared, we have the proper equipment to be able to protect ourselves and to be able to render the care and aid to anybody who calls, regardless. We've been exposed to a lot of stuff over the years, and we just take the general precautions every single time, because we never know what we're walking into.
Mm-hmm.
And just like with the police officers, you don't know what you're going to until you get there. And so we take the precautions before we get in there.
Okay. Is there protocols for coordinations between the three, but between the two departments at least?
Yeah, we're going to coordinate and then yield to fire. They'll convey.
Okay. Very good. Let me take more questions from...
One thing, just
please
in general, working in an emergency room, I can tell you something. The fire department, the ambulances are always in communication with the ER.
Mm-hmm.
So before the case hit the ER, we know most of the stuff going on.
I've seen that Beaumont installed a new
like
inflatable
outside,
tent outside. What's the reason for that, Chief?
Well, we actually have a couple of those type of tents too, just in case our system gets overtaxed.
Okay.
For the hospital, what we're afraid that may happen, which we're trying to avoid, is if we have too many calls and people are needing and wanting to go to the hospital. Needing is one thing. Wanting to go to the hospital is another thing, because then we take them to the hospital.
Yes.
Now they have to take care of them. It takes space, because they take a bed. It takes resources, the nurses and the doctors and everything else, where after we've taken them to a hospital, now we start getting patients like having heart attacks or strokes, and the hospital's already full.
Yeah.
So when the hospital sets up that tent, the inflatable tent,
yes,
that's to be able to expand their emergency room and to be able to assess and check out patients before they come in. So we're not bringing in infected patients. We can assess them outside. We can make sure that they're, quote, clean before we bring them inside.
Mustafa is asking, based on whatever you've said right now, Mustafa is asking, do hospitals in the US have the capacity to, if let's say there is an influx of cases in the thousands, do we have the capacity to treat and have enough beds?
Well, as I said, there is 100,000 ICU beds.
Okay.
There is more regular beds in the hospitals. So most of the cases are mild.
Okay.
Because they're mild, they're not going to be admitted to like ICU beds.
Okay.
They're going to be in regular beds. Okay, we have
Wouldn't they be isolated?
They're going to need to be isolated for sure, and we can practice isolation, not a problem. This is not something that is not doable. We can absolutely isolate. There is capacity, like happened in the emergency room. You can put stuff outside, where you have the inflatables or whatever, that we can keep those patients in and take care of them right in those inflatables. That, by the way, have the negative pressure that will circulate the air. So it is something doable. Plus, the system is catching up and catching up quick.
Very good.
This is something you are not gonna have every day. So when something like this hit, you have to react, and we are reacting.
I think there is the repetitive question with the same idea, so I'm going to ask just one question, but I'll mention the name of the people who asked the question. I have like Farida, for example, I have Majida, I have George, I have Zaina. They ask almost the same question. They're asking about restaurants, gyms, swimming pools, those areas. Should we go to the gym? Should we go to the restaurant? Should we go to pools now, or should we take a break?
No.
No, don't go?
Don't go to gyms.
All right.
Okay.
I mean, some gyms already closed. We know some gyms
waiting
in
for
the
that.
area already closed.
Yeah.
But that's a great question, by the way. I mean,
Right.
people are asking, should we, I mean,
What are you doing
we don't
in a gym?
want to harm businesses coming at the same
We
time.
are not. We are
But
not. We are taking precautions.
They're asking about restaurants, gym, and pools.
Right.
Recommendations
Right.
from you guys.
So I can tell you my 2 cents on the thing.
Yes.
Number one is, in a gym, you are sweating. You are using multiple equipment. If you have COVID-19, you're going to be spreading it left and right. So is it prudent at this point in time to go to the gym for 2 weeks? I don't think it is. In my opinion, I think we should stay away until those gyms are disinfected and properly cleaned, and at the same time, this contagion starts calming down and less cases. Then you're going to go to the gym and live there, no problem. Go ahead and do that as much as you want.
We got some of the same questions, but in Arabic. So for Arabic, they were asking, هل صلاة الجم والمسابح فيها خطورة as well as المكاتب and whatnot. So just a quick answer for the
صلاة الجمعة at this
وقفوهم
point.
لصلاة الجمعة.
وقفوها.
ما عادش في صلاة جمعة.
ما في صلاة جمعة هلا. I'm not a sheikh to answer you legally, you know, religiously what to do, but I can tell you something. Crowding in a Salat Jum'ah at this point in time is, again, not a good idea. At least for a couple of weeks. We're not talking about 2 years. We're talking about a couple of weeks. You know, something we have to understand, this is short term. People are thinking maybe they're going to be on lockdown for 2 years. It's not. It's short term. It's a couple of weeks. We have to ride this, you know, wave for a couple of weeks, and then hopefully it will be all over.
You know, another question we also answer: إذا كان الشخص لقط العدوى ولا يجد لديه عوارض، هل ممكن أن يعدي غيره? And you know, the answer was نعم. You know,
absolutely he will. بيعدي غيره لأنه السبب بسيط جدا، لأنه الفيروس عم تنتقل من قلب من عنده لبرا، وهي الشيء عم تخلي تصير من بني آدم لبني آدم. نعم بيعدي.
Mails and packages. شو؟
That's tough.
That's tough.
Amazon, it's coming from China.
Really tough.
Well,
What should you do? I mean, if you get a package, what should you do? I mean, if you get
I
a mail,
open it.
You open
If
it.
I get a package, I'm
I mean,
going to
do you
open
use
it.
gloves? Do you
You
basically?
said you ordered shoes and they came.
Can I tell you what I do?
Please.
You have Lysol spray?
Yeah.
Yep. Lysol that thing, spray, and then open it. It's
Okay.
as simple as that. Lysol spray will kill whatever's on it, and then you can open it.
Wash your hands after.
And then
That's
wash
all.
your hands. That's exactly right.
That's simple
something to
stuff,
do.
but I mean, will
Yeah,
help.
simple stuff, absolutely.
Yeah.
Because if it's coming from Amazon, it's got to be good.
Yeah.
So I'm going to make sure I open it. So.
That's
Okay.
right.
بالنسبة مو
It's not a
أيوب
bill.
مو أيوب is saying I have a wedding tomorrow. What should I do?
I have a wedding tomorrow too.
بعد ما كنسلوا الweddings by the way.
No.
قالوا it's no more than.
I got a wedding tomorrow too.
Ask him where the wedding is.
Thank you so much.
I mean, they're not supposed to be a gathering of more than 250
I
people.
know.
How are still halls
of
and
weddings
banquets
are getting
open
cancelled,
to have weddings?
Well, here's what I'm gonna do. I'm gonna take the نقطة. I'm gonna drop it in the box. I'm gonna say congratulations and have a great night.
Very good.
I'm not gonna kiss anybody. I'm not gonna touch anybody. I know everybody will forgive me for the next 2 weeks, and then after that I can say
Mail it.
I love you guys.
Mail it for now.
No. For now, just take the thing, put it in, and then just come say hi, congratulations, without touching no one, and you can leave.
A lot of people, since it's not school anymore now, and tickets are so cheap, they're traveling. They're going on vacations. Seriously, I've seen a lot of stories of people. Oh, your tickets are cheap now.
Let's go.
Yeah, let's go on a
let's
cruise.
go on a
cruise. Exactly.
This is actually breaking news. Frontier is now offering free flights for people who.
To Italy?
Sounds like a good thing and a bad thing.
To Italy. Frontier. Great. Let's go.
Okay. Your comment on traveling.
I'm going to tell you.
Domestic and international traveling. I mean,
I'm going to give you a little example. They canceled the National American College of Physicians meeting. So
Okay.
that should tell you something. They canceled the biggest meeting in the U.S. every year.
for medical
The
professionals.
For medical professional, American College of Physicians. We're all professionals under one roof, and I can assure you everybody's going to be taking their utmost precaution, yet they canceled it. So I would cancel regular gathering for now. Again, it's only short period of time. We do not need to panic. It's not going to be for 2 years. Look what happened in China. We learn lessons quickly. When it happened in China started in December. Look now, China is bouncing and recovering in a couple of months. Although it was the hub of infection, am I correct?
100%.
Yet they're recovering quickly. We're not the hub of infection here in the United States of America. We should not panic. That's the bottom line.
If many more people get infected, would it stop itself?
If there is something called herd immunity. I don't know if you know about it. So herd immunity, if you have 10 people in a room, okay, let's say 7 get infected, okay, 2 dies, and then this one person does not get infected or die or anything happened because other people got immunity or they died. You know, in this case, I'm not saying that the 2 or 3 or whatever is going to die. What I'm trying to say is that some people will get infected by themselves, and then other people will never ever experience any infection or anything.
When it comes now, if people have like doctor visits or visits for their kids. I mean, dentist, doctor visits, stuff. Do you recommend they go and do them, or?
Well, I can
should
tell
they
you
delay
about my clinic today. You know, 3/4 of the patient did not show up.
Oh.
So that gives you an idea of what people are doing. They're canceling their office visits. Okay. Again, for a week or two, if this is just a healthy child visit or well care visit or whatever it is, you don't have to go.
Let's say you have symptoms. Should you go to the clinic or should you go directly to the emergency?
Depends
or which
where you
protocol they
were.
want them?
Okay, it depends when you were. If you came in from Wuhan, I'm going to say, don't come to my office, go directly to the emergency
So
room.
should they call the clinic first, the doctor, the primary doctor first, and
yes.
if
And
based
let us
on the
know.
recommendation?
Let us know. Some doctors are proposing not to admit any patient to their waiting area. Keep them in the car and call them one by one from their car.
Ah, wallah.
Yeah, that's what
Not even go into the welcome area.
Not go to their waiting area. Just stay in your car. We'll call you or text message you when your time is coming. You come in. We see you and we'll let you go.
Okay.
That's what some people are doing. I do it this way. If you're sick, let me know you're sick. That's all. I posted this everywhere. Let me know you're sick. We put a face mask on you, put you in isolation room. I can take a look at you. If there's no issues, I'll just say, okay, goodbye. If there's something going on that is very serious, then I'm going to say emergency room or further testing.
Do you guys recommend if someone is calling sick for them to go by themselves using their own car, or should they call you guys?
Well, and like you had said earlier, need more information.
Okay.
Okay.
So give me
if-
different scenarios,
Okay.
Chief, you don't mind.
If you're having difficulty breathing,
Uh-huh.
you're struggling to breathe, call us. If you're having heart pains, you're like a heart attack, chest pains, call us.
Okay.
If you're able to walk around the house and do normal daily things, call your doctor. Share your signs and symptoms with the doctor. If you're well enough to be able to get through the house and do certain things without any discomfort, then you probably don't need an ambulance to take you to the hospital. Again, call your family doctor, call the clinic. They may have a different entrance for you and say, okay, well, we're going to have you at this door so that we can properly take you in. Like he was talking about with isolation rooms.
Yes.
Let them know, and they're going to direct you. Okay.
I wanted to add on to that. I know Wayne County Public Health Division. They have an awareness campaign going on, and they're encouraging people. They have a hotline where if you have any questions or you want to speak about what it could possibly be or what you have, you can call 211, and they would give you more information. Speak to you.
And that's a phenomenal resource. I think the biggest problem that we're facing right now in a lot of these questions, people don't know. They're afraid because we don't know. You said it right at the beginning. People are afraid of what they don't know. The trusted websites, use those, the cdc.gov, the state of Michigan site, even the city of Dearborn.org. They have a lot of good, trusted, valid information. Facebook, not so good. Okay? Get your information from a trusted source and use that tip line. Call your doctor. That's valid information.
Yeah.
I want to add
Go ahead,
something
please.
just real quick about the ambulance system and the usage of the ambulance system. I'm not saying don't use them. Absolutely, if you need them, you should use them. Any shortness of breath, chest pain, stuff like that, definitely. But I was reading about, about what happened in Italy. Some cities, their ambulance system collapsed completely because there was so much taxed. When you're calling the ambulances nonstop. I mean, at the end of the day, we're human beings.
100%.
So we have capacity. So if somebody has a little fever, I don't think they need an ambulance to go in whatever. Somebody having something really catastrophic and something that need an ambulance, then by all means. But something that you can deal with directly between you and your doctor, go ahead and do it through the doctor.
Very good. Please go ahead.
One last thing
No,
with
take your
that.
time. I mean,
We have typically 6, sometimes 7 ambulances per day for the city of Dearborn and Melvindale combined. That means at any given time, we could take care of 6 to 7 people at one time.
Okay.
That's it.
That's it. 6 to 7 people in 2 cities.
At one time. Now, granted, once we get free from the hospital, we can come get another person.
Okay.
Where we start to have a problem is if we get some of these calls that don't need an ambulance, but they want to go by ambulance for the sniffles, a cold or something like that.
Would you tell them go use your own car?
Well,
Or you can't?
we can suggest,
Okay.
but we can't tell them. If you tell me, no, I want to ride in your ambulance, well, then we're going to take you. And we're also going to let you know that there's a possibility that maybe your neighbor down the street is having a heart attack.
So you're going to go by priority?
Well, no, we
No?
have to take you. If you're with us already,
Who
we
would
have
you
to
take?
take you
Who
to
would you
hospital.
take first? Let's say you received
The
2
person
calls.
who called first.
Whoever called first. It doesn't go by case.
Once we show up on scene, once
Okay.
we get there, we have a duty to act. And we can't leave you. So I will stay right by your side the entire time, either on scene until you decide that you don't want to go,
Okay.
or until we take you to the hospital. And that's where the real problem for us comes up is if we're transporting somebody that doesn't really need the ambulance, somebody else may. And now it's delayed. So instead of being able to get to the gentleman having a heart attack within 4 to 5 minutes, it might take 10 minutes.
Yeah.
You're limited on resource. You can't.
Exactly.
Absolutely.
And
That's
that's what we're really afraid of, getting into a jam with, is running out of our resources. We're limited.
Yeah.
We'll do the best we can, but we only have
Since
so many.
the state of emergency is activated, would you guys be able to use county and state resources too?
They're
or
busy
no?
too.
They're busy too.
And that's, I mean, every single city, they have certain number of resources. And once, it's like with Beaumont Hospital. If Beaumont Hospital is overrun and extremely busy, you can guarantee that every single hospital is just as busy.
So is Beaumont Dearborn the one that's capable now of doing testing, or
Yeah.
is there other hospitals here?
So Beaumont Dearborn is able of testing. I'm not sure if they're doing the run also to Lansing or not. Today I got a call from Wayne about a potential case, and I asked them yes to go ahead and test, and then there's going to be a run to Lansing until the kits are available. But I was promised next Friday that we're going to have the testing kits on site.
A lot of people are asking the same question also كمان ما قيل هل السفر في عبر الولايات المتحدة في الوقت الحالي شو رأيكم فيه وبأي وسيلة آمنة يعني they're asking is it good to travel now, if so, if I need to travel, what kind of, should I go via plane,
transportation
should I
method,
go drive?
Per Dr. Fauci, the chief of infectious disease of the NIH, this is what he recommended today, and I just listened to his speech before I came. He said, if I'm going on a trip inside the United States for fun,
Yes.
I'm going to cancel that trip. If it's something catastrophic that I have to go and attend, I will surely go, whether by plane or by car or by whatever. But again, if it is for fun, I would leave it alone. If it is something just that as a public worker that I have to go and do public servant, then I have to go. So that is, I think, is a very prudent answer, a very good answer. That fun,
Let's say you have to
delay
go.
the fun.
Let's say you have to go.
Okay.
Which precautions you should take while traveling?
The regular precaution that you usually take. You got to use hand sanitizer, wash your hands, avoid people that are sick, stay away from crowded places, and at the same time, always report any symptoms that you get. Fever, cough, chills, stuff like that. Because you never know if you got infected or not.
Yeah.
I know you mentioned testing-wise, you guys are equipped, and the current process is it's a swab test that they do, and they
Nasal and oral and pharyngeal.
they have a runner that takes it to the Lansing where it gets tested. In the coming days, it will be done locally, where you guys
We're
will
hoping it's going to be done locally at the lab, and then we can get the answers. And now, today, with the rapid test that hopefully the FDA is going to roll, we're going to have a whole lot of stuff coming in. I'm hoping, again, this is the United States, so hopefully we'll have, quick response.
So what's the difference that's going to happen? Is it technology that you're going to be bringing into the hospital, or is it your current labs are going to, what exactly?
So basically, this is a technology that's needed inside the lab to analyze that we're going to be brought in.
Okay.
There is a comment that was written. I mean, I'm going to read it, but George is saying, not sure Dr. Dakroub is up to date on Beaumont Dearborn. No disrespect, but my family tested positive there. That's one that's watching us right now. He's saying that one of his family members tested positive for COVID-19. And he's saying that it was not handled well, and I heard the nurse asking for a mask. How is there no masks there?
Well,
And he's saying that the staff is being told to reuse their mask.
sure. Well, again, this is to answer him. There's no mask because people are hoarding masks.
Okay.
It's as simple as that. You go to buy masks, there are no masks. So we need to leave the mask for the professional, for the hospitals, for the police, for the fire, for the people who needs to use them.
Yes.
Now, is there no mask? Yes, and a lot of places in the hospital.
Even the
Whether
hospitals
it-
don't have
Yes, even the hospitals.
shortage.
Yes, there is. Yes, there is. N95s were taken off all the floors, because there is no, because you try to get, if the general public are hoarding, multiple masks, well, what am I going to find masks? So yes, I am up to date, but I don't want to spread panic. There's a difference between up to date and being panicked, and spreading a message of panic. We don't want to spread a message
But
of
بعدنا
panic.
هلا بلشنا دكتور. We just started right now. I mean, having cases. Why they're not ready?
You know what? When you are using and you don't have the capacity to roll right now. Now, they're starting to manufacture more, but it's going to take a minute for them to come in. So I want to ask you a question.
Please.
Why somebody living in an apartment somewhere or in a house somewhere need to have a box of N95? Can you give me one reason?
But isn't
There's
that
no
a risk?
reason.
Isn't that the medical staff there, the nurses and the doctors that are being in contact
There is
with
risk. There is risk for everybody, doctors, nurses, everybody. But you know what? When it's needed, it's being utilized. Not sure his information are correct 100%.
100%. نحن we're not supporting any, but basically
Yeah,
just.
I'm not sure. Yeah, if
it's
somebody is
it's an unfiltered
Yeah.
comment. I mean,
When
but
if
we have
somebody-
to basically ask it since.
When somebody is, you know, we're taking away these masks and putting them aside to when they're needed.
Yes.
Okay, so if somebody, yes, has a corona COVID-19 positive, you know, definitely they're given, the staff are given N95 and we're using them. It's not we are out completely, it's not true. But again, we are trying to ration these masks. So please, 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 my advice for everybody, do not buy these masks because we need them. And when we need them, when we don't find them, it's a risk for us and for you guys.
Very good. Let me, again, acknowledge whoever is watching us on TCD Dearborn and WhatsApp Media Network. Make sure you share this live stream so more people can watch and get the information from the expert, so they can be knowledgeable and educated on the topic. In terms of Ali, he's asking if supermarkets and places are raising prices on cleaning supplies and food supplies, what can we do? بالعربي علي سؤاله كان إذا المحلات عم بتزيد أسعار المنظفات والمواد الغذائية فأين وكيف نقدم شكوى؟ علي في you can fill a complaint form with the Attorney General office. There is a link, we can send it to you, or TCD can send it to you. And there is a phone number you can call. So either a form or a phone number. So في رقم تليفون وفي فورم فيكم تعبوه وتبعتوه للمدعية العامة بميشيغان دانا نسل، وهم إذا حيلا واحد عم بيعلي أسعار بشكل مش مزبوط بيقدروا هني they can act on that. كمان حسين دكتور حسين سعد بيقول God bless all of the first responders, doctors, nurses and whoever risks their own health to help those in our community. أكيد we echo whatever you said, doctor. Muhammad Uday is asking, do you recommend that people quarantine themselves if they come home from a trip overseas?
It would depend where did they go. Places where there are cases, yes, I would do that just to be on the safe side. Would quarantine myself for 14 days, pending, you know, further details of what's going on. Somebody gets a fever along the way, coming back home, definitely need to be quarantined themselves, especially if they're coming in a plane or cruise ship or something like that. I would practice most precaution, and we need to dilute the curve or flatten the curve right now so that we don't tax the system. Like Chief Haddad said, you know, we have to flatten that curve. It's extremely important. This will cause less taxing on the system and will help ease the burden of cases if we get that.
Okay, Mohammed, do you have any question? Because we have like about 5 minutes. We're going to resume in 5 minutes.
You asked, you mentioned in Arabic regarding the Attorney General's
Yes.
office and whatnot, with price gouging, where local supermarkets and stores and retail stores are increasing the price of hand sanitizer, of water, of toilet paper.
Initial stuff, essential stuff.
Essential stuff, and sanitizing, material.
I mean, we've seen some of the pictures for one of the stores. We're not going to call names right now, but it was all over social media. I mean, the hand sanitizer that's a $1 sanitizer, they put it for $9.99.
Which is very unacceptable. It's not acceptable.
Even on Amazon, I tried to get some hand sanitizer for the office.
It's not.
Even when it's available, the 1 liter is for $150.
Yes.
Wow. That is a lot of money for a little bit of hand
Chief, can you comment on that?
No, the only thing I can say is you don't know what they had to pay for that. You know, they may have had to pay a higher price from someone else to have a convenience for their community. It may be, unethical, but maybe they had to pay more to get it. They're not.
There are two cases. One could be them price gouging, or it could be the supplier that
the
they're
supplier.
Yeah, you cannot tell. I mean,
price. But the Attorney General's office is asking people to contact them and reporting, suspected, offenses, to be reported to her office immediately.
Very good, very good. And we came to a conclusion for this show. It was a very amazing show. I'm going to give each one of you like closing remarks. What's your message to the community? What do you want to tell everyone, whether as a recommendation or whether whenever you want to tell? Chief, we'll start with you.
Okay, thank you. I want to reiterate that we need to stay calm.
Yes.
And as a community and as a nation, we're really ahead of the curve right now as far as mitigating this
Yes.
oncoming virus disease. And we mentioned some people are nervous about opening mail. I want you to open this letter. It's coming from the census.
Yes.
We can stand to gain, I don't want to talk about losing, but we can stand to gain 180 million over the next 10 years if we're properly counted. If we're undercounted, we know what the consequence will be. Please answer your census. We're depending on you. Your first responders will be here. No matter what happens in our city, we'll keep you safe. So thank you.
Sure. Go ahead, Chief.
Like Chief Haddad just said, we're here for you. If you need us, don't hesitate. Give us a call. Call 911. We will be there 24/7. And if you have questions or your concerns, check with your family doctor first. But if you are seriously ill or hurt, don't hesitate. We're here. We're not closing. So we'll be here for you.
Sure.
Again, I want to just end with what I started with. We should not panic. Panic will not help anybody. Hoarding will not help anybody. I think the best thing to do is if you have a case that's suspected, contact the professionals and we'll handle it. We'll handle it and we'll handle it in a way that will give a good outcome for everybody. I think it's the system will catch up and will catch up quickly, and I don't think everybody is, going to reach a bad ending. I think it's going to be a happy ending.
Inshallah.
And everybody, will stay safe, and God bless this country.
Muhammad, it's your
I just want to remind everybody, as we discussed before, stay healthy, stay in shape, keep taking your, prescribed medication as usual, sleep well, maintain a healthy diet. I know you mentioned consuming zinc and
vitamin D,
vitamin C,
vitamin D,
the
vitamin
50
C.
microgram, sorry. And then, yeah, just, staying hydrated and whatnot.
Yeah.
So that's my, message to all our viewers.
Awesome. Well, thank you, Muhammad. Thank you, Dr. Dakroub. Thank
you.
you, Battalion Chief Glenn Owens. And thank you, Chief Haddad, for being with us today.
Thank you.
This was it for us, guys. It's a couple comments before I close. Sam Jafar from Wayne County, he's saying, we have a slogan at Wayne County, slow the spread, wash hands often, keep a distance of 6 feet plus, and stay out of large crowds. Sarah is asking about pets. Would pets get the virus too? I'm sorry, before we close, that's a very important question.
I got asked the same question yesterday.
So
there
would
was
dogs
one
get,
case, anecdotal, from a dog to a human being. I'm not sure about the validity of this. As far as I know, as of today, the pets will not transfer virus.
No. Okay, very good. So the answer was no, Sarah. Akidi, at the end of this show, I want to thank our guests. I want to thank our viewers, everyone that basically watched the show. I want to thank TCD Dearborn and One Dearborn for partnering with WhatsApp Media to basically produce the show and air it on both our pages. So everyone in the community and outside the community can benefit from those amazing and beneficial information. We ask you that you stay resilient, don't panic.
Wash your hands.
Wash your hands. Don't spread
Buying
fear.
toilet paper.
That's right, toilet paper.
Wash your hands.
Extremely important.
Make sure you share this live stream.
I
so
couldn't find
everyone
any
can
toilet
benefit
paper
from-
today for the office.
Yeah, make sure make sure you share this live stream so everyone can benefit from those information. This was Hussein Hashim from WhatsApp Media Network and Mo Qasim from TCD Dearborn. Until we meet next time, thank you and have a good evening.